right.
Let me share my screen.
Can somebody send me a link for the Bronx? We don't have anybody being able to get in.
Can you give me the, what? Oh, what is that?
Let's mute.
Rochelle,
Yes.
all
Good.
yours.
Good morning, everyone. Welcome to the first ever citywide Developmental Disabilities Council's virtual legislative breakfast of champions. Produced by the leadership of all 5 developmental disability councils and family support services advisory councils in New York City. I do hope you have your non-virtual beverages and breakfast treats ready to go. Due to the wonders of modern technology, we are privileged to be able to hear from all our speakers at the same time, no matter where we live. My name is Rochelle Kivanowski, and I will be your host for this morning's event. I am the mom of a wonderful young man named David, who started his journey in a therapeutic nursery school. I'm very sorry about that. In a therapeutic nursery in a specialized school, and graduated from District 75 and has participated in a full range of waiver services from OPWDD for the last 30 years. We are here this morning to learn about all the critical issues confronting services for people with intellectual and developmental disabilities and their families. We will hear from individuals and family members, the staff and agencies who support us, our political leaders in the legislatures, and those in government who are responsible for developing and managing our services. At the end of the program, we will give you some ideas for actions you can take to ensure these services continue well into the future. Before we begin our formal program, I would like to give you a few words about the rules. Everyone will remain muted except for our panelists. We encourage people to put their questions in the chat, and one of our committee members will try to provide an answer, or after the program, we will forward your question to the appropriate presenter and let you know their response. People on the phone can contact their DD counsel with any questions for follow-up. It is just about a year since the COVID-19 pandemic attacked our city. All of us here today are acutely aware of the devastating impact this dreaded virus has had on our loved ones and on their dedicated staff. Over 600 people with intellectual and developmental disabilities have passed away, and over 13,000 direct support professionals have been infected, too many of whom have also passed on. We would like to start today's program with a moment of silence as we remember all the beloved people in our community that we have lost. Thank you. And now on to our program. We're going to start with hearing from representatives from state and local government who are responsible for delivering our services and overseeing our services. Our first speaker will be through video, and her name is Delia Tucker. She is the Acting Director of Regional Office 4 from the New York State Office for People with Developmental Disabilities.
Good morning, and thank you for the opportunity to join you for this conference as we look at where we are and where we are going in ensuring the delivery of services and supports to people with intellectual and developmental disabilities during these challenging times. I had the opportunity to speak at one of the legislative breakfasts held last year in person, and thinking back on it now, without us knowing it, we were at the beginning of what would be a very consequential year in all of our lives. The pandemic has changed the lives of all of us, especially the lives of people with intellectual and developmental disabilities and their families. When I first came to work in the regional office in 2019, I knew the work wouldn't be without challenges, but I hadn't envisioned dealing with the threat of a deadly virus and the impact it would have on the people we support. However, I find that only when we are faced with difficulties do we know how strong we really are. Throughout this year, I've had the privilege of partnering alongside parents, siblings, agencies, and other advocates to make sure that we meet the health and safety needs of the people we support and to ensure access to needed supports and services. Throughout history, we've seen that adversity can bring forward positive changes. During this year, I've witnessed us learn to work remotely, have conversations about reimagining day services, and create flexibilities to help support people during the pandemic. There have been difficult decisions that have been made, but I'll remind you that overcoming adversity can help build resistance, make us stronger, and give us more confidence as we encounter challenges in the future. The staff at OPWDD are committed to ensuring the delivery of services and supports to people with intellectual and developmental disabilities during these unprecedented times. We thank you for your advocacy, and I look forward to continuing to partner with you. Thank you.
Thank you very much. Next we will hear from Dr. Ted Kastner, who is the Commissioner of New York State Office for People with Developmental Disabilities. Commissioner.
Thank you, Rochelle, and good morning. It's a pleasure to be here with so many of you virtually today. It's difficult to cover the 5 boroughs. It's wonderful that we can do this all together. I'm just going to begin with talking about the budget. As you know, one of the first orders of business for any new year is the budget, which is expected to be completed by April 1st. Governor Cuomo continues to make strategic investments in the OPWDD service system designed to maintain access, increase equity, and enhance the sustainability of our community-based person-centered service system. These investments have enabled OPWDD to offer certified housing supports in the community with 36,000 certified community-based residential opportunities. These opportunities are supported by a total of $5.2 billion in public resources annually. Over the past 5 years, we've also invested $710 million in the salaries of direct support professionals and clinical staff. Increased funding has now allowed us to increase home and community-based service enrollment by 28% over the past 7 years, to increase self-direction enrollment by 161% over the past 4 years, to increase independent living arrangements by 170% in the past 8 years, to increase day program and employment options by 11% over the past 5 years, and to increase the number of people receiving respite services by 22% over the past 2 years. In addition, over the last year, we've increased our CCO enrollment by about 6% to 109,000 individuals. This year's budget builds upon those accomplishments. Despite the pandemic, in fiscal year 2022, growth in state spending on OPWDD programs will increase to almost $4 billion, or more than $9.1 billion when all shares funding is included. In this year, we will receive an additional $110 million, or a 2.8% year-over-year increase, which will fund minimum wage increases for staff in the nonprofit sector, with a new investment of $32 million in state resources, which equates to about $58 million in all share funding, which will support the transition to a $15 per hour minimum wage. New resources will also support new services for OPWDD eligible individuals and their families for the 8th consecutive year, and commits $15 million in new capital funding to continue efforts to expand the availability of affordable housing for the past 7 years. In addition, OPWDD supports ongoing efforts to enhance our ability to deliver person-centered services. In fiscal year 2022, we will increase access to residential services in the most integrated settings by expanding the options available to individuals across our continuum of supports, which includes apartments with wraparound support and family care. We will also assist individuals who have aged out of their residential schools to move to appropriate adult residential opportunities. OPWDD will continue to allow individuals to receive community habilitation and respite using telemodalities, and make investments in respite opportunities for those families in need of short-term support. Finally, we will enhance and strengthen the quality of research for people with developmental disabilities by transitioning the Institute for Basic Research from OPWDD to the Office for Mental Health, and leverage their research expertise. In terms of last year's fiscal plan, there were some adjustments. Last year's budget included savings measures that limited reimbursement for individuals who are not in residence at residential settings. We've been successful in delaying these savings measures from October 1st of 2020 They've been pushed into May 1st of 2021. In addition, last year, as a result of cash flow concerns related to COVID, OPWDD implemented a 20% withhold on non-Medicaid local assistance payments. Effective February 24th, the withhold was lifted, and we're now in the process of looking at how to repay the funds that were held and return those to our providers. The proposed budget for next year is based on New York State receiving an estimated $6 billion in federal COVID relief assistance. The budget calls for the implementation of a 5% reduction in OPWDD non-Medicaid local assistance payments and a reduction equivalent to a 1% across the board reduction effective April 1st, 2021. These spending cuts can be restored if the state receives $15 billion in federal COVID relief, which is what we believe to be New York State's fair share. I would like to talk for a moment about the impact that COVID-19 has had on our community. Obviously,
Commissioner, if I may, if you could just
a tragedy.
another 30 seconds, please.
Okay. I want to thank our families and individuals who have made extraordinary sacrifices during the past year. We have also been fortunate to work with our DSPs and clinical staff. They've been at the front line of our battle against the pandemic. And finally, many of our volunteer provider organizations have been extremely helpful. As of yesterday, we reported 9,766 people with disabilities and 13,219 staff who'd been infected with COVID. We've also unfortunately reported that 634 individuals with disabilities have passed away as a result of COVID. And this is a heartbreaking loss. I'm certain that the losses would have been far greater if not for the support that you've helped us with over the past year. I just want to bring up the vaccine rollout quickly. As you know, in December, people with intellectual and developmental disabilities living in certified residential facilities and their staff were prioritized as 1A. As of February 26, 72% of individuals in residential services have received at least one dose of the vaccine, and 10.3% have declined. In addition, 22.3% of residential staff have received at least one, and 38% have declined. We are working with our CCOs to now focus on individuals who live in the community. That rollout began on February 15th. As of February 26th, about 4% of individuals living at home have received one dose and 4% have declined. So we're making progress in that area. We expect to see significant steps forward, particularly individuals living in the community over the next month or so. In deference to the time, let me close and thank you for your continued partnership and your support of our work.
Thank you so much, Commissioner, for your informative speech. We now move on to Lydia Ledniak, who's the Associate Commissioner of New York City Early Intervention. Ms. Ledniak.
Good morning. First, I would like to thank the DD Councils for inviting me to give remarks and for creating this first virtual forum, which allows legislators and policymakers to not only hear provider concerns, but also the concerns and issues raised by families. We in the New York City Department of Health share your goals of providing children birth to age 3 with developmental delays or disabilities and their families with services that they need as early as possible, and for ensuring that those services continue to be available for all New York City families who need them. Throughout the pandemic, the New York City Early Intervention Program has responded quickly to the changing needs of families and providers. Very early in the pandemic, we shifted all home-based early intervention services and evaluations to teletherapy in order to reduce the community transmission of COVID-19, and we worked with families in order to get children the services that they needed. During the pandemic, life changed, and as a result, we saw fewer children going to pediatric well-child visits and in-person early childhood services. And as a result, we saw a significant drop in referrals to the New York City Early Intervention Program in the spring of 2020. We closely track these data and reported on this decline in referrals. We also put in measures in place to ensure that healthcare, childcare, and community-based organizations were aware that early intervention services were available and critically important. Due to our efforts and the efforts of the provider community, we saw a gradual recovery in our referral rates. And at this point, I'm happy to say that our referral rates are back to pre-pandemic levels. I'm also proud to say that the New York City Early Intervention Program acted swiftly to make in-person services an available option as soon as the New York State provided authorization. And while teletherapy does remain the recommended mode of service delivery due to the ongoing pandemic, in-person home, community, and group services are available as appropriate based on the unique needs of the child and family. And with those in-person services are delivered, they're delivered in a way that are safe for children, families, and providers. The 2021 governor's budget proposes to eliminate early intervention extended sessions, which will either result in changes to service delivery or cost the city up to $77 million across all payers, including approximately $21 million in city funds to make up for the elimination of extended sessions in the New York City program. Additionally, the budget proposes to continue withholding 20% from each payment to local governments for early intervention services. If this pandemic has shown us anything, it's the importance of supporting systems that serve our youngest and most vulnerable children. A critical aspect of that support is ensuring that early intervention services are properly funded. I wish you luck in your legislative breakfast and all of your 2021 advocacy activities. Thank you.
Thank you so much for that very interesting report. And now we move to Ms. Janice Chisholm, who's the Assistant Commissioner of New York City Department of Health and Mental Hygiene. And we want to extend a particular thank you to your department for all the support that you gave our providers during the pandemic, particularly in securing PPE and other required stuff that we need. I'm sorry. Good morning. Okay,
Thanks so much. Thanks, Rochelle. Greetings, service participants and families, legislators, city and state colleagues, Dee Borough Council members, and all stakeholders. It is my honor to join you from the New York City Department of Health, Bureau of Developmental Disabilities at today's citywide legislative breakfast. We are grateful for the opportunity to listen and learn from you about how best to meet the service needs of individuals with intellectual and developmental disabilities here in New York City. The configuration of today's event is itself testimony to the impact that the current health crisis has had and continues to have on each of us and all of our ways of living and being. Owing to COVID-19, our coming together in this room today takes on a special importance. For while we have spent scores of years getting together to advocate for filling service gaps and right-sizing our systems of care for individuals with intellectual and developmental disabilities, this historic meeting is being held while we are working closer together and more determinedly than ever to save lives and protect health amidst the devastation of a worldwide health crisis. We all know from our work over the past year that individuals with IDD, their families, advocates, and service providers have been particularly impacted by COVID-19. Whether residing independently or with family in the community, or in residential congregate settings, individuals with IDD are at risk for lasting, severe outcomes, whether they themselves and or their supports succumb to illness and its aftermath. And certainly, individuals residing in residential congregate settings have been particularly at risk during the height of the pandemic. Many in the room have been partners to the Bureau of Developmental Disabilities and our many Division of Mental Hygiene and Emergency Response colleagues at the City Department of Health throughout this health crisis. Working closely and continuously, we've convened weekly and sometimes more frequent and after-hours discussions with state partners, providers, associations, advocates, and other key stakeholders. Together, we have worked tirelessly and timely to identify and address many issues and overcome tremendous hurdles to assume and assure services continuity and integrity for individuals with IDD and their families. Together, we created mechanisms for distributing PPE widely and ongoingly. We explored paths for supporting staffing needs, including engaging city colleagues at Workforce One. We identified the need for and developed tools to assist in informing the crafting of supports to accommodate individuals with IDD in city-sponsored isolation quarantine hotels. We distributed test kits and worked closely to assure that vaccine planning and operations were in place, first at residential congregate settings and more recently for individuals residing in the community at large. We have collected and shared data points regarding the numbers of individuals and staffing falling ill, and in the worst case, those succumbing to COVID-19. Like you, we realize the burden that the current health crisis has placed on this community. The Bureau of DD, along with our Division of Mental Hygiene and Emergency Response colleagues, remained and continue to be in constant contact with you, holding routine provider meetings, presenting informational webinars, conducting telesite visits, regularly issuing guidance materials, and responding to your calls and emails seeking support. We are with you in this most significant time of need, as we have been before the crisis. We will continue to partner with you, to hear you and coordinate efforts with you, to move together so that we recognize, understand, anticipate, and respond to need. Like you, we know that we must hone and use lessons learned to promote services and supports that are in keeping with the realities of increased need that has been compounded by an unprecedented, widespread health crisis. Your work today is ever more important, and I join you to look forward. Thank you.
Thank you so much. Now we will move to some statements from our political leaders. And first, we're going to have a recording from the Honorable John Mannion, who is the chair of the newly formed New York State Senate Committee on Disabilities and is one of our great champions.
Good morning, this is Senator John Mannion. I represent the 50th Senate District, which is in and around Syracuse, New York. And I just want to say I feel awful that I cannot attend today. Obviously, it's a very busy day, as many of you know. So I have to focus on other things, and I'll be in conference during the time that I was supposed to attend. But I will tell you, as the nephew of a woman who had Down syndrome, and as the parent of a 22-year-old child with autism, it is more important than ever that we restore the cuts that exist in the executive budget. We just can't have this. The providers that are out there are already working on a razor's edge, and this just could be damning. We need to provide the people of this community and their families with the respect and the dignity that they deserve. And the only way that that's going to happen is that we restore the funding that should be there. And long term, we have to have a better plan because it's just unsustainable. The people that provide these services, including direct service providers, they're the ones that also need to be treated with respect and dignity. And the only way that we can do that is to make sure that we pay them a fair and decent wage so that we can recruit more and retain the good people that are there that have established the relationships with the people of this community. So I am proud to stand with you and to fight alongside you to make sure that the funding is there for one of our most vulnerable populations. Thank you for everything that everybody does. We're all going to keep fighting together. And I do apologize for not being there today. I think everybody understands, but know that in Albany and across the state, I'm fighting and others are too. Thank you.
Next, we will hear from the Honorable Michael Benedetto, who is the chair of the Committee of New York State Committee of Education in the New York State Assembly. Assemblyman?
He
put in the chat, apologize again because he had to go, but be assured that we in the Democratic Conference in the Assembly are aware of your difficulties and are fighting against cuts to OPWDD. I am with you and will continue to fight for you and people with developmental disabilities.
Okay. Thank you for that. And we're confident that we do have the support of Assemblymember Benedetto. Is Assemblymember Abenanti here?
He has not arrived yet.
Okay. In that case, then we will move on, and hopefully he will arrive later. And we will move on to a brief video presentation from Louis Grossman, who is the Chief Executive Officer of Advanced Care Alliance New York, one of our care coordination organizations in New York State, who will talk about the impact of the pending cuts to these organizations.
My name is Louis Grossman. I am the Chief Executive Officer of Advanced Care Alliance of New York. It is my privilege to share our concerns on behalf of the 7 care coordination organizations that have touched the lives of 110,000 developmentally disabled people across New York State. Care management is a vital service, which is a lifeline for individuals and their families, and are at risk of losing life-sustaining services due to an egregious rate reduction proposed in Governor Cuomo's 2020-21 budget. The care coordination organizations were created by New York State to provide critical and essential services to New York State's most vulnerable citizens. A decade ago, Governor Cuomo promised care management for all. And after 7 years of development, in 2018, the 7 care coordination organizations began providing essential services. Last year, Governor Cuomo's budget reduced our operating rates by 16.2%. This equated to a reduction of $73 million. This year, the governor's proposed budget is reflecting an additional 23% reduction, equaling $93 million. In essence, in just 14 months, $166 million are being reduced from the operating rates of the 7 care coordination organizations. A reduction of this magnitude is unprecedented. People with developmental disabilities face up to 5 times the risk of dying from COVID-19. Many require assistance to access basic needs such as food, housing, and medicine. They present with complex medical, behavioral, and social conditions that require special care. The care coordination organizations are critical in ensuring that services are available. We are their voice, we are their advocates. Many will lose access to benefits such as Medicaid. We are not asking for additional dollars. We want what was promised and what our members rely on. We are requesting Governor Cuomo to dedicate a portion of the $2 billion in enhanced federal Medicaid funds, which are already committed to New York State by President Biden. Please do not allow the most vulnerable citizens of New York to shoulder an additional $93 million rate reduction. The 7 care coordination organizations cannot provide the quality and standard of support with a rate reduction of this magnitude. We appeal to you on behalf of the 110,000 developmentally disabled individuals to whom we provide essential services. Thank you.
Thank you so much. We're now going to move on to the portion of our program where we'll be talking about the key areas of service delivery that are under threat. And there will be presentations by each of the boroughs. We're going to start with the Bronx, who will talk about the importance of clinical services. We'll move on to Brooklyn, which will talk about early intervention. Queens, which will talk about education services. Manhattan, who will discuss day services. And last but certainly not least, Staten Island will be discussing residential services. So with that, I turn the program over to our borough chairs.
Hello, my name is Joanne Siegel, and I'm the Bronx Borough President of the Bronx DD Council, and I'm here to present the clinical component and needs for the population of individuals with developmental disabilities. But before I do that, I think I want to just thank actually the governor for prioritizing our individuals to obtain the COVID vaccine. That was a very, very important step. New York is one of the first states to prioritize our individuals with intellectual and developmental disabilities. I will ask though one request. I would hope that the governor would extend the COVID vaccine to family caretakers who take care of their individuals in their own homes, the families, the parents, mothers and fathers, who without them, individuals with IDD would be left without home care. So I would like to ask that they include family caretakers within the group of caretakers that are now currently being vaccinated. With that, let me start with our clinical services. We're asking for no cuts to the Article 16 and 28 clinics. These are specialty clinics that provide evaluation and specialty services such as psychological testing, psychiatry, speech and language services, physical therapy and occupational therapy. They have long been underfunded for years, and now with COVID, these services are in more demand and waiting lists are growing, so that evaluations are now taking as long as 4 to 6 months to be initiated. The second request we have is for durable medical equipment and specialty equipment such as customized wheelchairs. During COVID, this equipment is being more and more difficult to acquire, and COVID has just made even the process of repairing equipment all the more problematic, with families not being able to either go to a facility or a repair being done in the home. The third component of clinical care is that we would like to include a permanent elimination of a restriction in telehealth provider location. What that means is telemedicine is becoming more and more important, particularly during the COVID epidemic. And at the moment, individuals can receive telehealth and telemedicine within their own homes. We would like to see that providers also be allowed to not be linked just to a site, so that we could have more access for staff to be used outside of a facility. And the fourth area that we're asking for is we're supporting the passage of Senate Bill 1578, that was sponsored by Senator Gustavo Rivera from the Bronx, and it has an Assembly Bill 299 that would amend the Social Service Law 365A so that it would include behavioral analysis to be provided by a licensed behavior analyst or certified behavior analyst under coverage for Medicaid recipients. So we find that that's really important for our families that have adults and children that are autistic, and this way Medicaid would reimburse ABA plans. With that, what I would like to do now is introduce Danielle Lanzetta in a video with her mother and father, John and Linda Lanzetta, and they're going to discuss the need for clinical and home services for individuals with intellectual and developmental disabilities.
I remember my daughter when she was young. She was in a walker and she was walking by herself. She was holding herself up and she was walking, which I just felt was so heartwarming for me. When she lost all that, not only did it hurt her, we could have had a normal life, but our lives have been changed because of that.
Danielle was born at 26 weeks and was born at 1.5 pounds. She was not supposed to survive. You knew she was bright. She was tracking the tags on the respirator and she was trying to get up. And from then on, it was all downhill.
I was born with cerebral palsy, spastic quadriplegia, and I was diagnosed at 1 year of age. I can't dress myself. I can't bathe myself. I can't toilet myself. Without early intervention, I don't know where I would be. I would be so much worse. Because of the CP, I require OTPT, nutrition, and physiatry. If I don't do this, the pain level is excruciating to the point where I can't function. They are not covering basic equipment that we need that's known as durable equipment. On my wheelchairs, I need headrests, I need harnesses to hold my head up. Right now, both of them are broken. And as you can see right now, I'm having trouble holding my head up because the muscles in my neck are so tight that it's pulling my head down.
I'm hoping that our politicians will see the light and try and help these children before they become adults. With the politics the way it is today, they could be devastating to those people and their families.
When I look into my parents' eyes, I see love, I see protection, and I see hope.
I now would like to introduce Assemblyman Jeffrey Dinowitz from the Bronx, Assembly District 81. He has been a staunch advocate for services for individuals with developmental disabilities. He co-hosts every year our legislative breakfast, and this year he's joining us remotely. He is the chair on the Committee of Codes. He is also on the committee, the Health Committee, as well as the Ways and Means Committee. And we thank you, and many other committees. We thank you for joining us this morning.
Okay.
Yeah.
Thank you, Joanne. It's good to be here with you. I don't want to say how many years I've been coming to the breakfast, but when I first started, my kids were 11 and 8. Now they have each have 2 kids, 2 of whom are 6. So you do the math. I'll tell you, I think this is my 28th breakfast, and you have it each year on the last, I think it was the last Friday in February every year. I think you pretty much picked the coldest or the snowiest day of the year, but we always made it, and you always had a huge crowd, and it was they were really great breakfasts. So this year we're joined by the 4 non-mainland boroughs, so it's good to see everybody around the city. I think you know the budget situation we're facing, but I have a slightly different perspective than the representative from the state. I think we can do better. I think we must do better. We certainly do want to get massive funding from the federal government, but regardless of what happens with the federal government, we have to make sure that we take care of the priorities that we care about. And I think the Assembly budget resolution and the Senate resolution that'll be voted on a week from Monday will be better. And I hope that the ultimate budget that we pass will really provide for many of the needs that Joanne and others will be talking about. But let me just mention the 2 areas that I was asked to talk about. And before I even do that, I just want to say that every year we fight to get things done in the budget, but our ability to get things done is largely dependent upon the work that you all do, the lobbying, the letter writing, the emails, breakfasts, everything, because what you do really empowers us to get things done in Albany. So I just want to say thank you to everybody, whether it's direct care workers, every individual that's on this call and beyond that. You really make a difference, and we appreciate it. Now, in the budget, you talked about telehealth services, and I think that's very important. We've learned during the past year that there are a lot of things we can do that we didn't do in the past, and some of those things we're going to continue. But telehealth, and I'm just looking at my notes here, where we would expand telehealth services that can be delivered, and I think that's very important. Increase information exchange through statewide health information network. Establish a licensure program that would authorize certain out-of-state practitioners to provide telehealth services to patients in New York. And that's important because we want to have as large a pool as possible of those who are going to be providing these services. Require insurance plans, private plans, to author adequate telehealth network, and require healthcare providers to inform their patients if they provide telehealth services. So all those things are really important, and I think we've learned during the past year that there are more ways to do things than we thought about in the past. You mentioned a bill, Assembly Bill 299 by Assemblymember Godfrey. This is really important because it would amend the social services law to include applied behavioral analysis provided by a licensed behavior analyst, I'm getting tongue-tied here, or certified behavior analyst assistant under standard coverage for Medicaid recipients. And this is important because in the past, applied behavior analysts was added to a New York commercial insurance coverage requirements, but it still wasn't included in the Medicaid program. And that really cuts out a large number of people. Oh, they're just calling the assembly to order as I speak. So I think this is something we need to do. This is an important bill, and I think this is going to be very helpful to a lot of people. I know we're supposed to be brief, so I'm going to stop it there. But again, I just want to say to everybody, and I know some of my colleagues are here as well. I saw Assembly members Benedetto, Cusick, Rosenthal, and Fall, and I saw Council Member Grodenchik, and I'm sure others have joined us. I just want to say thank you to all of you. Your advocacy really changes lives. So have a good day, everybody, and a good rest of the breakfast.
Thank you. Okay. Thank you so much to the Assembly member. And now we move on to Brooklyn and DD Council Chair Joyce Levin.
Good morning, everybody. Thank you for joining us, and sorry to everybody who might have had some problems getting on. We're happy that you can join us. The topic for Brooklyn that we're going to discuss is early intervention. And I just have a couple of things, and then I'm going to introduce an expert to speak about that. We call on the Assembly and to reject the proposed EI administrative changes and reductions. We call on being allowed to provide the services now to minimize the lifelong services down the road. Some early intervention right now will save the need for the services down the road. And it's such a vital service for our most vulnerable children. We want to stop any cuts to services which eliminate back group services on the same day, limiting group sizes, limiting one-to-one aids in a group of to 4, and the elimination of back-to-back sessions. We also want to call on to allow ABA and behavior intervention strategies to be included as an important element of any intervention program for young children with autism. And we also call on the governor to provide COVID relief to the providers who've been so devastated during this past year. And now I'd like to call on Chris Treba, who is our IAC expert in early intervention. So Chris.
Hi, good morning, everyone. And thank you for inviting me. And thank you for recognizing the importance of services to our youngest children. Early intervention is authorized under Part C of the Federal Individuals with Disabilities Education Act. It provides critical services to children who have disabilities and developmental delays from birth to 3 years of age and their families. And research has documented that high quality early intervention services can change a child's developmental future. It can improve outcomes for families and for communities. There is national research by the National Early Intervention Longitudinal Study that found that 46% of children who had developmental delays entering early intervention didn't need special education by the time they reached kindergarten services. and they credit early intervention for that. Early intervention is such a critically important program for infants and toddlers with developmental delays, but New York State has not funded it that way. The early intervention program has been inadequately funded for years and targeted for cuts over decades. In fact, some early intervention rates today are lower than they were when the program started 30 years ago. The governor's executive budget targets the early intervention programs for cuts based on administrative changes to services that can be authorized on an IFSP, an individualized family service plan. If you look at that slide, it outlines exactly the cuts that are being proposed. I call them cuts because they are supposed to recognize $11.9 million in savings. And you see the bullseye on the baby. These are the kids who are getting these services. These are infants and toddlers. And they are being targeted in terms of reducing the services that are available to them. And many of the proposed cuts would affect children on the autism spectrum. They would specifically limit those services to those children. We're most concerned about these administrative cuts because they can be implemented by New York State's Bureau of Early Intervention without any legislative change. And they're seeking savings from the program that's not necessary. We know from data from the New York State Early Intervention Coordinating Council meeting in December that there were fewer children receiving early intervention services because of the pandemic. In just the second and third quarters of 2020, 11,000, close to 11,000 fewer children received early intervention services, and fewer children also received the actual services. An analysis of claims submitted for early intervention services document that New York State saved more than $50 million in 2 quarters because children weren't getting the services that they needed. Advocates for Children also documented this decline in enrollment and referral services in a report that they issued. I do want to thank Assemblymember Dick Gottfried, who has been a tireless champion for early intervention services and has protected services to these children for so many years. He's proposing legislation that would prohibit these changes, and we urge all members of the New York State Legislature to support those actions. I also want to thank New York City Associate Commissioner for Early Intervention, Lydia Ledniak. She demonstrated outstanding leadership during the pandemic and took swift and decisive action to sustain EI services in New York City. And she helped transform the system immediately to allow teletherapy services when they were available and authorized by the state of New York. We know, based on years of research, that the earlier the child receives intervention, the better the educational outcomes for those children and the less dependent they are on adults for services. We know that children who have the greatest needs will not go away when this pandemic is resolved. We know, like Lydia said earlier, that the referral rates are back to where they were before the pandemic. We know that there are thousands of children who potentially need special education services and who are not receiving them right now, and they may not receive them until they're identified, possibly at kindergarten. This will have dire implications for New York State and on the quality of life for these unfortunate children. If New York State fails to act and protect early intervention services, the impact of this pandemic on our youngest children with developmental disabilities will last for years, and they will suffer the greatest consequences. And so we urge you to reject all of the governor's proposals because they really have no basis in any clinical benefit to children. They're just another cost-cutting measure to early intervention services. Thank you.
Thank you, Chris. I see that Senator Ganaris, I think, had to leave and was sorry that he had to leave, but he's been a very great supporter of our services in Brooklyn, and we continue to hope to have his support on our needs. Thank you. Is Senator Prasad here? Okay, I don't think she's here.
Yet.
To come back to her. Thank you.
Tom Abenanti is here. Hi.
Oh, excellent, Assembly Member. We can give you some time now to speak. We're very happy to have you here as the chair of the Assembly Committee on Disability.
Nice to see you. I apologize. I didn't seem to have the link. And I was fiddling around trying to get into a codes committee meeting and now I'm in session. This digital world, rather than having made things simpler for us, has made it much more complex because we're expected to be in several places at once. But at any rate, thank you for letting me join you this morning. We need to focus more than ever on the needs of people with disabilities. We in New York had slowly built a system which could meet the needs of all of our people. But that system is on paper. And little by little, that system is being taken apart in reality. We heard before the cuts to early intervention, and there are cuts to every aspect of the system that New York has to help people who face the challenges of disabilities. Some of the cuts are not so obvious. There's a slow strangulation going on with the addition of regulation on top of regulation on top of regulation, with the delay in the payment, with the manipulation of the system so that requests for budget amendments or additional monies or additional services are rerouted and reviewed, and the entire system has been slowed down. The end result is we don't have the system that some people brag about in the state of New York. And a lot of people with disabilities are really not getting the services that they deserve to get, and which on paper, the state says are available to them. So we need to come together and speak out and explain to the public, number one, that people with disabilities with a little bit of help can achieve the quality of life that we all want to have, can become tax-paying citizens, can have jobs, can have nice places to live, and in many cases have families of their own. But they just need a little bit of help, and the earlier they get that help, the better. And secondly, we have to explain that the state of New York, while it pretends to provide these services, is really not providing these services, that they're not available to everyone who needs them. And thirdly, that even those services that are available are not being properly funded. The executive branch, year after year, attacks the most vulnerable. And included in that group of very vulnerable people are people with disabilities. This year's budget is another example. The executive branch will talk about how they've added staff to OPWDD. But if you take a close look, you will see that the staff at OPWDD is actually down by 300 since last year. If you take a look at the numbers and they talk about how they're providing more money, they're not providing more money. If you look carefully, you'll see it's less money. So we need to band together. We need to push really hard and publicly. We've got to let everybody know that the promise is still just a promise. It's not a reality. So thank you for letting me join you this morning. We are working as hard as we can in the Assembly to restore the monies that need to be restored and to push forward with a program that's going to help people with disabilities. But this is only going to be effective if we all work together, and we work together publicly and make it clear that the state of New York has to be a leader in the nation in helping all people in the state of New York.
Thank you so much, Assembly Member, for your ongoing advocacy and passionate advocacy for people with IDD. And especially for taking time on this very critical day to come meet with us. And now we move on to Lisa Veglia, the chair of the Queens DD Council.
Good morning, everyone. Thank you for joining us. I'm Lisa Veglia, chair of the Queens Council and also CEO of Cusick. I want to first thank our elected officials for being here and for your ongoing support. Thank you. As well as our government partners from OPWDD in New York City. Thank you for being here or providing a video. I want to acknowledge my colleagues from the other boroughs. It's been a pleasure working with all of you during this critical time. So you're going to hear again from Chris Trieber to talk about the education issues. But I'm just going to highlight briefly some of our asks, which are mainly around additional $8 million for teacher retention funds, as well as a rate adjustment process to protect provider rates that were impacted due to the pandemic, as well as a payment mechanism to provide immediate relief for providers who are struggling with enrollment issues due to COVID-19. But I'd say the biggest and most critical ask is a statewide joint public hearing to address our rate inequity with the public schools. 4410 and 853 providers receive substantially less tuition rates to support children with the highest needs compared to the public schools. And it's only recently that parents of children in our program have learned that differential. In some cases, it's a 50% rate reduction. So they're wondering why their children who have the greatest needs, who are referred to 4410s and 853s by the public schools, are provided the least amount of resources to educate those children. We had a rally last month organized by our parents, and I'm going to show you a video of that right now, because who better to hear it from than directly from a parent? Jennifer.
Lifeline for myself and for my son before the pandemic and especially during the pandemic. As a parent to a child with special needs, I've lost count of the times I have had this vague feeling that my child is treated differently. But when it comes to the lack of funding in our 4410 and 853 schools, there is no gray area, no excuses, no maybes. The discrimination is right there in black and white in every annual budget for the last 10 years. So in closing this event, I want to leave with a call to action. I want to directly address Governor Cuomo since ultimately he's in charge of the budget. Governor Cuomo, we are at a crisis point, but you still have the chance to reverse course here. As I'm sure you know, our schools have been closing at alarming rates for the past 5 years. 31 in New York City alone and 63 in New York State. 28% vacancy rate for teachers. 1 in every 4 of those teachers will leave each year because they are not paid a living wage as professionals. It's shameful. Losing a teacher will negatively impact any child, but these seismic shifts in daily life can be catastrophic for our kids. So I ask you, Governor Cuomo, how much longer will you continue to facilitate this glaring discrepancy between how our schools are funded and how other public schools are funded? Funds for other public schools have increased every single year since you've been in office, while 4410 and 853 budgets remain mostly stagnant. The majority of us have no choice but to join these programs. We aren't asking for more, we're asking for equity. On your website, you say, New York, we pride ourselves on being the progressive capital of the nation. Not just in talking the talk, but in walking the walk. Not just in rhetoric, but in reality. Get it done. It's about results. That's how you judge a government. We've made great progress that no other state has made in social equity issues, end quote. Governor, can you honestly tell us you are walking the walk for our kids? I applauded when you talked the talk last summer and deemed in-person special education essential. But then you left our schools in the lurch, many unable to open until late September, and many facing closures, including my son's school since then, because they weren't given any PPE. I want to ask you why, and I want you to think really carefully about your answer here. Why aren't our kids a priority? You've done a great job with so many things, and I've come to your defense more than once. But you have left us behind. There's no denying that. I've listened to most of your briefings, and this goes against everything you've spoken about in terms of equity. This isn't who I thought you were. But you were right when you said we've made great progress. But if you're leaving people behind, progress is only an illusion. These kids will go on to do great things, but only when they have the same quality, access, and equity as their peers. And right now, they're getting cut off at the knees during toddlerhood. Despite your inaction on this issue during each one of your terms, I trust you to hear us and make this right, because I think you are a person who doesn't mind being taken to task. I believe in you. Will you show us that you believe in our kids by investing in their schools? It's time for you to walk that walk and get those results for our kids. If judgment is based on action, as you say, how will you be judged? Don't let discrimination be your legacy. For our elected officials who joined us today, thank you so much. We voted you in to represent us, so please listen. We know the state budget isn't some form that gets blindly approved each year. We know there are many meetings held to discuss the budget. So we know that every year officials sat down at a table and decided that our kids were not worth the money. This is a conscious decision to give them less. And we can only assume that less is given because less is expected of our kids. All we can do is assume, because for the last 10 years, all the schools have received is silence. But if you choose not to speak up for us, the parents and voters, your silence is an answer all on its own. Your silence tells us that you hear us, but it's easier to ignore us. Your silence means you don't believe in our kids' potential. Sometimes it feels like you don't think they even have potential. Your silence means discrimination is okay sometimes. Silence tells us that our kids' futures are negotiable. They aren't worth the trouble of speaking up for. And most importantly, your silence shows that you don't represent us. So please amplify our voices by raising your own, and maybe Governor Cuomo will hear us all the way in Albany. Don't turn your backs on these kids. Don't just say you believe in them. Show us you believe in them by investing in their schools and their teachers. Stand with us and ask them why our children are worth less than others in New York State. And to my fellow parents and voters, we deserve answers from all of our elected officials. We deserve to know why the neglect of these critical programs has been allowed to continue. We want to hear the justification for this. And then we want them to realize that there is no justifying blatant discrimination in 2021 or ever, especially in the state of New York. And then we want you to help initiate change in Albany for our forgotten children. Don't lose hope, fellow parents. We have to keep fighting for what we know is right: equity, access, and quality education for our children. Thank you.
Thank you, Jennifer. Now to Chris Trieber.
Hi, everyone. Thanks, Lisa, for inviting me to speak about education. When I watched Jennifer's video, I'm just so amazed at the powerful message that she sends and the courage that it took for her to do that. And we had many parents during that rally that did that. And they did it because they understood some very clear things. Our schools, our 4410 and 853 programs, are public schools. Children come to the schools because the committees on special ed or preschool special ed have determined they cannot educate these children. There's no other school for them. There's no other place to provide an appropriate education, and yet they've been significantly underfunded for years. You'll see the slide right here. It talks about equity. Equity says that children are treated equally. The other slide, that's okay. And you can see the difference. Since 2012, that's 10 years. Public funding to school districts, to state local aid to districts has increased by 40%. And yet our 853 schools that serve children from the age of 5 to 21, received a 26% increase in that time. And our preschools have only received a 10% increase. So when you hear Jennifer in the video ask, why are our children not a priority? Why are they not valued? There's the evidence. They see it. It's very clear to parents now. The other thing that I think is really very visible is that our schools are suffering because of this lack of adequate funding. They can't hire certified teachers. They can't recruit them, and they're having significant challenges retaining them. Every child in our schools are entitled to have a certified special education teacher teach them. However, many of them experience teachers leaving throughout the year because our schools are unable to pay them anywhere near what a public school can pay their teachers. There's a tale of two teachers. Those two teachers in this example both have the same level of certification. They're both certified special education teachers. The difference is one works for one of our schools, and the average salary is $51,000. And if they work in a public school, the average salary is $87,000. Teachers in our schools work 12 months. Teachers in public schools work 10 months. Teachers in public schools get lifetime medical benefits for the most part, and teachers in our schools have to pay for theirs. They have no pension. You can see the difference in terms of the fringe benefit. So teachers leave our schools not because they want to, but because they have to, because it's a better quality of life for their families. How are we supposed to provide a quality education to children in our schools when we don't have the ability to be competitive in terms of hiring and maintaining teachers? I think it's very important to remember that our schools have remained open. Our schools, majority of them started opening in-person instruction in the summer. All of them have been open since September. Every single one has been providing in-person instruction to families who sent their children, who wanted their children in those buildings. These teachers who are getting paid so much substantially less have done so much for the children. They've done so many different things. They visited families at home. They've dropped off devices. They brought materials to children in shelters. They have worked tirelessly to transform an education system overnight from in-person to ensuring that all children can receive remote instruction. Those things didn't just happen simply because the teachers said, you know what, I can't figure this out. I need more money. I need more help. They did it. And they did it because they care about the kids. But caring's not enough when you don't have a teacher to teach a classroom. And that really is the essence of what the parents were bringing up on the video, the rally. Parents asked, why are their children treated differently? Why are their children not being valued? And so in order to honor that ask, in order to honor why, we are requesting a public hearing so that parents around the state can demand answers to the question about why their children are treated differently, why their children are worth less in their eyes. That's how they see this. And they have a right to demand answers. That's why I believe this whole issue has changed fundamentally. The moment that we had that parent rally, it's no longer providers asking these questions, it's parents who are holding the system accountable as to why their children are not getting what they really should be and what they're entitled to. I think that parents are the ones that are saying and asking the questions as to why this has been going on for so long. The evidence is very clear, and New York State does need to act. And the only way to act, we believe, is through a public hearing that will allow parents and advocates and providers to raise concerns in regard to what's been happening, to ask for answers, and ultimately to demand for a plan that's going to fix it. Because that's at the end of the day what parents want. They want to know why, but they also want to know how it's going to get fixed. How is this change going to happen? Parents identify this as discrimination at this point of their kids. They see it no differently. If a child in a public school is funded at 50% more than what a child in our school gets, that's very clear to people. It's not hard to see those numbers. And so we are demanding that this public hearing take place to give parents an opportunity to ask questions about why is there not equity? Why is there not access? And then we also do need to recognize that there are fewer children right now receiving these services. And that is creating under-enrollment in our schools. A year ago, all the schools were full. Children were waiting in New York City for special education services. And now there aren't children filling those seats, but the providers, the programs are losing money because they don't have children in those seats. They get reimbursed based on enrollment. So we are calling on New York State to put a plan in place to provide immediate fiscal relief to programs that are in jeopardy of closing. We had one program that had been in Staten Island for almost 35 years. It was Volunteers of America. That program closed because they couldn't afford to stay open. These programs need to remain for children. Just to give you one final thought, in New York City, 85% of all of the preschool children who receive special education services are serviced by our schools. If our schools aren't there, New York City is not going to have the ability to serve them. So government needs to ensure that there are financial resources available to sustain these programs, because without them, we're going to go back to where we were a year ago. We're going to have children sitting at home waiting for services. And then you look back at early intervention and you say, we had all these children who haven't been identified yet. They're all going to need services too. And people need to ensure that these services are available when this pandemic is over, because the needs of these children are going to be greater. All the research says it. And without these services available, our children are going to suffer the greatest consequence. And I leave you with the last statement that Jennifer said. Why are our children not a priority? Our schools have not been a priority. We call upon the governor and the legislature to prioritize these kids, to make them a priority, to invest in our schools, invest in our teachers, and invest in our children. Thank you.
Thank you very much, Chris. And thank you for all your advocacy for the children that we serve. Now I'd like to introduce New York City Council member Barry Grodenchik, who comes to the Queens Council Breakfast every year to support our services. Welcome, Barry.
There.
Barry still with us?
He's still there, but I don't see it. And he's gone. Oh, technical issues. Sorry about that. I'm sure he'll join us again shortly.
We'll move on. We'll circle back. Give him an opportunity to speak. Thank you for being here.
Nope.
You're muted, Rochelle.
Hi, I'm sorry about that. I see that Senator Prasad has arrived, and I was wondering if she would like to say a few remarks.
Well, good day, everyone. Of course, you know I have to say a few remarks. It is great seeing everyone here. I know my colleagues, today was an unexpected session day for us. And I see my colleague, Mike Cusick, is out there. So we're back and forth. So it is great seeing all of you. As I love to tell everyone, the DD population is near and dear to my heart, near and dear to my family. My mother has worked in the industry forever. My brother he joined it, and then he just fell in love with it, and he decided this is where he was staying. And so we're always advocating for the community. Last year, there's an advocate who comes to my office who I've known for nearly 40 years. She's part of the YAI family. And because of her advocacy, we wanted to make sure that she was recognized by New York State. Because let me tell you, when you want to hear a person who's a self-advocate, she's a self-advocate, but she not only does that, when she talks, she's like, yeah, this is what I need, this is what I need. But then she talks about the needs of staffing. The needs of what we need to do for staff, the money that should be invested into the community, all of the things that are lacking, all of the things that we are not living up to the obligations that we should. And that's what Debbie Schwartz tells us every time she comes to Albany, or if she calls us or she emails us or whatever she does. So every year we come to your breakfast, it's this year we can't be there in person, but you have my continued commitment to working on your behalf, to ensure that, I saw somebody in the chat say, our children are not treated as if they're equal to others. Yes, they are equal to others. Some of you may have heard me say this also. I grew up with a friend. He was a couple of years older than us, and he was developmentally disabled. And we love to say he was smarter than all of us. He ran rings around us. So never let anyone tell you that your children are not on the same standard, the same level as other children.
Thank
Just
you,
remember
Senator
that.
Prasad.
You're welcome.
And
So
thank you so much for being our champion.
it's, you know
As
what?
always.
My mother would not have it any other way.
Yeah, I'm
So
sure
again,
that's
it's
true.
great that-
I'm
you
sure
know
that's
that.
true.
You know that. So it's great seeing all of you. And, as I said, we were running back and forth. Please, again, always reach out to my office, reach out to me. So whatever we can assist you with, I am here to assist you. And I will always be your champion. So
Thank you.
have a great day, everyone. And Commissioner, it's great to see you. Make sure you give them everything they need, Commissioner.
Thank you, Senator.
Thanks, everyone.
Okay, and now we move on to Manhattan and the Kathy Kelly, who's the chair of the Manhattan DD Council.
Good morning, all. I am Kathy Kelly from AHRC, New York City, and chairperson of the Manhattan Developmental Disabilities Council. We have just heard the stories and struggles facing the IDD community within the early intervention and education systems. Adult services for the IDD community are funded through the Office for People with Developmental Disabilities, OPWDD, primarily through Medicaid funding. For anyone that has attended a legislative breakfast in the past, today's discussion and presentation doesn't seem all that different. It seems year after year, we're here saying the same things. This year, regarding OPWDD budget services, we are asking for the full restoration of the cost of living adjustment, the COLA, a rejection of the proposed 1% targeted Medicaid rate reduction, and to enact statutory protection to ensure all cuts to the IDD system be restored with the additional federal funds currently and continually being received by New York State. This past year, as you can imagine, has had a significant impact on adult day services and employment supports. Finding new and creative ways to support people in their homes or remote settings while site-based programs and employment settings were forced to close. Striving to provide the needed support and training in as safe an environment as possible. The video you will now see features Yesenia Estrella, who is a parent of a child with a disability, as well as someone who works for Esperanza Center, a provider of day and employment services.
Melissa?
Sorry, I'm hopping on now. Good morning. My name is Sorry, everybody.
While that video is in the process, while we wait for to get that video up and running, let me just take a minute to kind of go into a little bit more detail, some of the struggles that the OPWDD providers and the people we support have been facing over the past several years. Over the past decade, not-for-profit providers have not had a cost of living increase for over 10 years. This has resulted in significant financial distress, with 1 in 3 providers having to close or modify their programs in order to meet their financial needs. In addition, 1/3 of providers have less than 30 days of cash on hand. Here to talk a little bit more about those impacts and what we're currently experiencing is Yesenia Estrella.
Good morning. My name is Yesenia Estrella, and I am the parent of a 9-year-old child with special needs. I am also a provider of day services. Back in March 2020, we were told to close our day program at the same time that the schools were being closed. Suddenly, the future became uncertain. Parents worried they couldn't manage, and staff were left thinking they had lost their jobs. Days later, we were told that New York State was going to provide retainer payment to providers to help us retain our staff. Retainer payments were limited to 80% of a previous income. The state also allowed flexibilities for us to deliver remote and in-home services when possible and to provide day services in supervised residences. The state also permitted the reduction in duration of services without financial penalty. But retainer payments were terminated on July 21st, and we were encouraged to bring people back into the day program. This continues to be a huge financial challenge. Serving less than 50% of our participants, so our revenues have been significantly cut. Yet we need the same amount of staff we had before COVID to provide in-person services. Without retainer payment, we are getting into a financial crisis. We still have to pay rent, and every time we have to close due to COVID cases, we need to pay staff sick leave. Retainer payments were what help us keep our staff in place. We cannot provide good quality services if we cannot keep our experienced staff, and we can't afford to continue paying them if the funds are not available. A solution to this problem would have been a modified extension of the initial retainer payment. Nobody expected this crisis to go so long. Providers are doing the best they can to survive under a fee-for-service system that does not make any sense during this pandemic. What is going to happen if providers have to close their doors? For many adults with developmental disabilities, day services programs are the only channel that connects them to the outside world. Day programs are essential for developing skills and for specialized behavior and employment training. COVID cannot be used as an excuse to reduce services, leaving people with disabilities with no place to go and many direct care workers without employment. Our direct support staff have been putting themselves and their families in danger throughout this pandemic while making the minimum wage. We need direct support staff to make a decent living, substantially above minimum wage. We need the cost of living adjustment to increase salaries and to cover other increased costs such as health insurance, workers' compensation, information technology, and COVID-related expenses like protective equipment and cleaning supplies and personnel. We need the flexibilities and funding to be able to sustain day program services and to retain our workforce. The proposed Medicaid cuts will aggravate everything and will greatly reduce the availability of crucial services. This is not the time to be talking about terminating services or making cuts to Medicaid. This is the time to come through and make our loved ones a priority during these challenging times. Thank you.
My name is Rashima. I just want to have my job back because it's the COVID, and I want to go back to mood fabric. Because I was working there for a long time. I met celebrities, people, nice co-workers, everybody nice. The whole half of the block loved me so much, they make me smile. They make me so smile, it just, without that, it's nothing to me. I just want my job back. I just want to go back to my routines, I'll be fine. That's the only thing I want right now. And I just want the president to help people to get their job back.
My name is Erica Moni Anthony Barclay. I like to do stay with the program, and I like to help them do different things like post office, murder, put the letter in the envelope and stuff. And the jewelry sometimes, not all the time. You can work in the office too. You can learn about the computer and stuff. I'm gonna know the password on the computer. You're gonna make copies and stuff. And I like to be Monday, Wednesday, and Friday here. And Tuesday, Thursday, working. Go back close. This one. Right here. Yeah. Go back here. And go to like sit and come back.
Day programs specialize on helping people reach their goals. These goals can be work-related, or they can be related to improving daily living skills, or simply socializing and having fun. Please help us keep our day programs open. Thank you.
Thank you, Yesenia, Rashima, and Erica, for that very powerful message. And, you know, we all hope that in the very near future, we can go back to in-person supports and be able to have the people we support in employment assist them in getting their jobs back. I'd now like to introduce a video, or two videos, one from Senator Brad Hoylman, followed by a video from Assembly Member Linda Rosenthal. Both have been tremendous supporters of the IDD community. So please welcome them.
Hi, I'm State Senator Brad Hoylman, and I represent the 27th Senate District. Thank you for inviting me to participate in your annual legislative breakfast. Your Advocacy Day in Albany is a highlight of the legislative session. I've been attending this breakfast for the last 9 years, but I'm sorry we couldn't meet this year in person. Organizations that serve people with disabilities have had to endure historic disinvestment for far too long. Unfortunately, the pandemic has only exacerbated the issue. Now, many programs and agencies that the disability community continues to rely on are facing an existential threat. We can't let this happen. We must not balance our budget on the backs of the most deserving and vulnerable. We need bold solutions to raise revenue so we can adequately fund the programs and organizations that serve people with disabilities. That's why I introduced legislation to repeal Trump's tax cuts for large corporations here in New York. It's part of the Invest in Our New York package, which I proudly co-sponsor to raise billions of dollars in annual revenue that we can use now. It's imperative that we increase funding for vital services such as OPWDD programs, the Early Intervention Program, and special education in our 4410 and 853 schools. We can start by restoring the cost of living adjustment for OPWDD programs and rejecting the governor's 1% across the board cut to Medicaid, especially during a pandemic. I'm also a strong supporter of the 3 for 5 initiative, committing to a 3% funding increase over the next 5 years for nonprofit provider organizations. I'll continue to fight against further disinvestment from services for people with disabilities. And I'll continue to advocate for the increased funding that is sorely needed and for the needs of the disability community to be recognized and prioritized. Thank you, and thank you for everything you do for our community.
Good morning, everybody. I'm Assemblymember Linda B. Rosenthal, and I represent the Upper West Side and parts of Hell's Kitchen in the 67th Assembly District in Manhattan. First, I want to thank the 5 boroughs, Developmental Disabilities Councils, for sponsoring this event. And I'd also like to thank all of the fierce advocates, service providers, parents, and my colleagues for joining together in support of preserving funding and services for the intellectually and developmentally disabled community. I must admit, I like it on Zoom, so I don't have to go to Union Square at 8 a.m. as we have in the past, but I do look forward to coming next year in person. You know, I know, and you know, of course, during the COVID-19 pandemic, providers work tirelessly to care for those with disabilities, striving to provide families with a stable and supportive environment amid crisis. These essential workers have faced additional challenges of often working without adequate pay or protections to keep them safe from the virus. At the height of the pandemic, providers struggled to provide PPE, and the chaotic vaccine rollout has not helped anybody. In the proposed state budget, the executive cuts OPWDD by 1.2% and a decrease in $330 million to service delivery system funding. You all know how devastating these cuts are, and I can assure you that the New York State Assembly will not tolerate them, and we will restore the money. I know families have endured so much hardship during the pandemic. Schools went remote, in-person services were severely limited. Early childhood special intervention programs saw a sharp enrollment decline as referrals and evaluations were delayed. Special ed students are entitled to supportive services in the classrooms at all ages, and then we must increase funding so that equitable education may be given to students with disabilities. You know, it's important to fight for the most vulnerable. It is important to raise revenue, as we are trying to do with 6 bills that will raise over $50 billion, so that we won't be a state where we try, but we leave people in pain and without services. It's unconscionable that New York State approaches the budget in that way. And so I am fighting, and many of my colleagues are fighting, to ensure that people who need services, who need extra attention, extra care, can get it here in the great state of New York. And I look forward to working with you and seeing you again soon.
Thank you so much. And it was really good to hear from our legislators, even if they couldn't be here in person. Now we're moving on to Staten Island, and we're going to hear from Donna Long, who is currently the co-chair of the Staten Island Advocacy Committee of the Staten Island DD Council and a former chair. Donna?
We're actually going to show the video first.
Tony has been diagnosed with Prader-Willi syndrome. When he was born, he was very floppy. He had low muscle tone. His metabolism is very, very slow. So as soon as they hit like childhood, it's like food is becoming an issue with them. Food is always, always on his mind. Food, constantly. They're actually never full. So Tony can actually eat himself to death. So we have to block off the kitchen. We have blocks that we use on our refrigerators, on our cabinets. Then we live in an apartment building, 87 steps. Let me tell you, 87 steps to go down, 87 steps to come up in the afternoon. And if he has an appointment, you're going back down those 87 steps. It's a lot for him. Tony loves to play Uno. He's like an Uno champ. We also like to go over his menu. Like on Sunday, we'll do his menu and ask him, what kind of fruits would you like? He makes his Jell-O by himself. He'll go in here and make his sandwich. We just monitor everything he's doing. Never leave Tony in the kitchen by himself. My biggest fear is Tony not actually with me anymore because he got into some food. Their stomach is just not that big to hold all of this. So if he like get into some food, his stomach can actually rupture and my son cannot be here anymore. My whole life is about my son. So if he's not here, what am I gonna do? What am I gonna do? And no matter what, I'm gonna fight to make sure my son has the placement that he needs and all the services he needs.
Good morning. My name is Barbara Devaney. I co-chair the Staten Island Developmental Disabilities Council Advocacy Committee with Donna Long, and I am a parent. As you just saw, Tony and his family face many challenges in making sure that he stays safe, healthy, and can enjoy a quality of life now that will be there for him in the future. Residential services in New York State are in crisis for a variety of reasons, which I'm sure everybody knows, and we don't have time to go into them now. I did have them listed. But it comes down to the fact that we are not important to the current administration, and there are less and less opportunities for our children. There is no more person-centered planning, and there is no choice. That is why we are asking our legislators to advocate with us to restore all the residential cuts in the executive budget for 2021-2022, including the residential cuts for therapeutic leave, retainer days, and vacancies planned for May 1st. Allow providers to accept eligible individuals requiring supervised residential services into existing vacancies and provide additional funding to support them. Require OPWDD to report annually on residential certified capacity versus the waiting list, and provide funding to develop new residences as needed. Provide additional funding to meet the increased needs of people already living in community residences. And provide additional funding to make direct support professional a career choice by offering a living wage. During this pandemic, we have hailed our DSPs as heroes. They have always been our heroes. They are the backbone of our field and they deserve a living wage. And then most importantly, include families and professionals in our field at the table when the decisions that affect our children and the people we support are being made. We are not considered, our thoughts are not considered. There's a select group and we're not included. We know best how to serve our children. The overwhelming need for restored funding and thoughtful decision-making will be further illustrated by the words of a desperate parent, which Donald Long, co-chair of the Advocacy Committee, will now share with you.
Thank you, Barbara. The mom who wrote this heartbreaking letter intended to be with us today, but unfortunately something came up and she couldn't be here with us. On her behalf, she asked me to read the letter that she sent to OPWDD. I must emphasize that this compelling letter was sent exactly 2 years ago. It's dated March 19th, 2019. In addition to this letter, this desperate mom sent emails and made numerous phone calls and no response. Nothing has changed for this family. Her daughter Leah is now 17 years old. This brave mom wanted to share her story in hopes of helping others as well. Here are her courageous words. And I hope I can get through it. I never thought it would come to me writing this letter. What normal parent would want to ask to live separately from their child? But I am asking for help. The last 15 years have felt as if the eggshell is slowly being broken to its core and there is nothing left. It is not the screaming and the breaking of furniture, the running around, not sleeping nights, banging on the walls. It is the other 2 lives that I am sacrificing besides my own, my other 2 children. When Leah gets into a state, I have to lock them in the room because they are afraid of her, and I am afraid she may hurt them, even if it's not intentional. She is a strong and tall girl, and she picks up furniture and throws it. My 6-year-old still wets the bed and wakes up screaming at night. The 11-year-old is frequently hysterical. Homework in our house is accompanied by screaming and humming. It is very difficult for the kids to focus, and they really struggle. My middle child has never invited his friends to our house. He just can't. Leah does not tolerate them playing, and not playing wildly, sometimes just regular play can trigger her. People slowly stop coming over to our house. I can't blame them. It is painful to watch and be around. It is also dangerous. We have to speak in half whispers when I try to parent the boys. She gets very upset and boom, another episode. We have ended up in the psychiatric hospital 3 times over the last month. In fact, while I'm writing this letter, she is still there on the unit. For some reason, it is the people that love her most that also aggravate her the most. But there is no surprise, she is a teenager. But sadly, not a regular one, with no impulse control, no way to predict or stop. When I try to stop her, she can grab me, and while screaming savagely, will swing me around until I hit the wall. I have to cover up bruises, often while going to work. I would not want anyone to know what is happening. Same goes for my mom and my husband. I am 5'3" and 110 pounds. My beautiful girl is 5'7" and 160 pounds, and she usually wins. I cannot hug her and calm her down as it used to be when she was little. I am powerless. There is not a single door or doorknob that is not broken in our house. Walls have indentations from fist marks. I have to sleep with the boys at night so she does not get into their room and scare them or hurt them. My husband often sleeps on the floor in front of her room. We try our best. My husband quit his job to stay home with her. However, that is no longer enough. He used to be able to take her to the park or just drive around to calm her down. That no longer works. She is unpredictable in the car and hits him on the head while he is driving. Going to the doctor requires 4 people, and it is often impossible. It took 10 police officers last time to get her into the ambulance and 6 more to hold her in the hospital, all while my heart was breaking. The only reason I called an ambulance is because she picked up a very heavy iron floor heater and threw it at me, and then would not let me near her while she was tearing down curtains. I was afraid the curtain rod would hurt her. Thankfully, the other kids were at my mother's. I send them there whenever I can. When I am writing this, my heart is aching because the facade is really, because behind this facade is a really sweet, misunderstood, and lonely girl who just needs help and friends and a life. I think that if she was in a more controlled setting among her peers, she would do better. Being in the hospital on the unit calms her down even before the medicines are given. Please help me, help my boys, and help my family to live and love each other without fear. Thank you for your consideration. This is one of thousands of heartbreaking stories of individuals waiting for residential opportunities. I've had numerous conversations with this mom, and she and her family are desperate. I implore OPWDD to help this family and do the right thing for them and for thousands of others who are waiting for residential opportunities. Thank you, and let's pray for this family. It is now my pleasure to introduce Assemblyman Michael Cusick, who I hope is not in session. There he is.
I am in session.
You are in session, okay, but you're multitasking.
Yeah.
He represents the 63rd Assembly District on Staten Island for the past 18 years, but Mike has been involved with issues throughout our borough. And we hold weekly legislative update meetings, and we started those in August, and Mike has attended every single one since they began. So thank you, Mike, for taking the time once again to join us.
Thank you, and thank you, Donna, and thank you to all of you participating here today. Thank you, Commissioner. Thank you to all the DD councils that are part of this, all the folks that are listening and on this Zoom call. At one point, it was well over 700 people I saw on my computer here that were taking part. That is fantastic, because that shows the advocacy and the passion for fighting during this budget season for people with disabilities, developmental disabilities, and I'm really proud to be part of this call. To all the family members and advocates and to the folks who work with our family members and neighbors with developmental disabilities, I want to thank you for all that you do. I know that it's been tough over the years. I know that, having been in office for as long as I've been in office, I witnessed the struggles of many families, many friends, many of the people who are on this call, the folks who are part of the Staten Island Developmental Disabilities Council. I know and I count as friends because they've been active and participating and helping other families for decades. And that's part of the universe that is created when we're all fighting for the same thing. And that is for our family members and neighbors with developmental disabilities and for the right thing. As Donna had mentioned, and I just want to give a little plug and also, encourage my colleagues from the other boroughs. We do the Staten Island DD Council started back in the summer, a meeting, and then it developed into a weekly meeting that we just give them updates. I do go on every week. My colleagues in government come on, or they send a representative from their office. And sometimes the meetings are 5 minutes, sometimes the meetings are an hour or so, but it gives the legislators an opportunity to really hear what the needs are. And then it allows us to bring it back to Albany and during this legislative process, particularly during the budget. So to my colleagues, if you're still on, I know that the Senate and the Assembly are in session right now, but please, I encourage you, start these weekly updates with your local DD councils. I would like to use my time today in the theme of the Staten Island delegation of the DD councils. I would like to use my time on pressing issues about residential facilities. And in recent years, there's been minimal development of certified 24/7 residential facilities, even as the demand grows. And I do have this discussion many times with families. The demand is growing every day. The current waiting list procedure is based solely on emergency need and does not reflect the reality of the need for increased residential facility capacity and development. And this is something that I do hear when talking not only at the DD Council, but with the many families who are in these issues personally and are looking for facilities for their family members. For those who are able to get into residential facilities, they face a host of additional issues once they get in. And that's also a issue that we need to address as legislators and as the OPWDD officials and the administration. Every budget, we talk about budget cuts, and budget cuts have been detrimental, particularly to OPWDD and to developmental disabilities programs. And it's something that I've been in office now. I hate to say because it'll show how long I've been in, but how old I am. I'm in my 19th year, and it seems every year we are fighting, and there shouldn't be that fight all the time. And this is yet another time that we are still fighting for our families and friends. DSPs working for minimum wage need to make a living wage. That is something that the Assembly Conference has been championing with you, with all the DD councils. And it's something that we need to encourage people to get into this career. But it's hard if we are not paying them what they are worth and what they deserve. Providers are not able to increase salaries of employees and therefore cannot recruit or retain qualified staff. And that's a major issue that we see as legislators. And it's one that we are trying to address in our conference in the Assembly. The OPWDD proposed flow considerations will relocate residents, and there will be even less opportunity for residents to live in their homes. Just speaking from someone from Staten Island, you know, it is important. A lot of the families that I work with when it comes to developmental disabilities, they do have their family members who are living at home or close to home. And it is important to have that family contact, as I know OPWDD understands. But it's something that, you know, I know Tom Abenante has spoken, and Aileen Gunther, who takes part in our weekly calls once in a while in Staten Island, they are fully aware, and it is certainly on our agenda in the Assembly Conference moving forward on this budget. As we get closer to the budget, April 1st, we're about 3 weeks away now. It's important that we keep up our work. And it includes work, a partnership of legislators with the DD councils and with the families and with the workers, the folks who work with people with developmental disabilities. It's important we stick together and we move together and we work with OPWDD and the governor's office to find that balance. You know, every budget is tough. It's tough to decide, you know, where the money's going to go. But for me and for many of my colleagues in the Assembly, you know, OPWDD issues should be a priority and should be on the top of the priority list when we're deciding where money goes. And I look forward to working with you in the next 3 weeks. We are going to push these issues as hard as we can in the next 3 weeks, and we can only do it with your help, with your insight and your support. So thank you so much for having me here today. It's always a pleasure to be with you. And I look forward to working with you in the next few weeks to get a successful budget for our families and our friends. Thank you.
Thank you so much, Assemblymember Cusick. And as everybody, I think, is noticing, we are at the end of our time. We did want to give you some actions you can take. And I think everybody here must have been as moved as I was by all the testimony we heard from individuals, from families, from our DSPs, about all the critical issues that are facing all people with IDD and their families throughout their lives. And there is a slide that has some actions you can participate in, but we will send them out to you by email. So everybody here will get that information. But another action I will encourage is join your local DD council. There are working committees in all the councils, and you can get active in advocacy work. Write to your legislators, call your legislators, let them know about your concerns. And you can see here's the slide with some actions you can take very quickly. Anchor is a federal group that is advocating right now so that the pandemic relief bill will include designated funds for home and community-based services that will go directly for our services. The ARC has a petition to stop the cuts and to restore funding and increase funding for our services and increase wages for DSPs. Advocates for Children has a petition about early intervention to stop the cuts. And there are the Twitter handles for the governor and the other state officials so that you can write to them about your concerns about equity for the specialized schools. And there is also another site that we will send you that you can sign on to a letter to oppose the cuts to the CCO services as well. So please take these actions. These are quick, these are easy. Join your DD councils and get involved, because it's only our voices that will help improve the lives of people with IDD and their families. I want to thank everybody on the committee who helped put this event together. I want to thank all our presenters, and we thank the commissioner for staying till the end of this program, and we look forward to a partnership with OPWDD to improve services for our family members. And I want to thank all the legislators who took time out of an extremely busy day today to come and express their support for our people and their families. So thank you most of all to all of you who came.
Oh, sorry, Rochelle. Councilmember Barry Grudenchik is on right now.
Oh,
So.
okay. One last word from the council member.
I thank you, Pat, and thank you to everybody who was here this morning. It's been, for a Friday, it's been a very busy day, and I'm looking forward in a little while to getting my first vaccination shot at August Martin High School. Hopefully that goes well. I know my counsel, Steve Behar, was here this morning. I just want to really thank Cusick and all of its supporters for the work that they do in my district and all throughout Queens and beyond. And that may sound a bit trite, but it is heartfelt. I have worked with Cusick for many, many years, going back decades now. And I know what you do, and I know the special needs children that you work with and the adults that you work with. And it's so important. And nothing just happens in our society. People sometimes see things and they don't look beyond the facade to see how much work goes into doing every single thing that gets done. So I know you've been here for a while now, but I just want to say thank you. Pat Barrientos knows how to find me, believe me. And he's very good at that. And I know that the budget is coming up, and you know, you have a tremendous amount of support in the Queens delegation of the City Council. And this is my last budget, but hopefully we can make it a really good one for Cusick and the work that you do. So thank you.
Thank you so much, council member. And I just want to say, we recognize that there were a lot of questions in the chat, and we will do our very best to forward those very important questions to the appropriate participants In particular, I think a lot were directed to OPWDD for information, and there were recommendations. And we look forward to hearing responses to all those questions. So we are not forgetting you. Once again, thank you everybody for coming. Get involved, and we look forward to seeing you again soon.